Now we take a closer look at home care. With our growing aging population, there's an increased demand for home care. But what exactly is it, and is it something for you or your loved ones? For some answers, joining us is Andre Best, founder of Best Home Care. Thank you for being with us.
Thanks for having me on.
So I think the question begs, what is the difference? What is exactly home care, and how does it differ from home health care?
Sure, I'm glad you asked that question because a lot of people get confused. The main difference is home health care is, as the name applies, health related. Home health care aides provide health related tasks such as administering medications and maybe even giving injections, whereas home care is a non-medical service. Home care aides provide assistance with daily living activities. These are bathing, dressing, grooming, toileting, eating, all non-medical services.
And I made reference to our aging population, but the services are provided for a whole variety of population, not just aging senior residents and that.
Yeah, exactly. Our recipients are 1 to 101, and they have varying special health care needs. So there's not one person that fits that mold. Children as well as elder people can get these types of services.
And what would be those services? What kinds of things? You mentioned briefly some caring, like bathing and things like that, but what are some of the other things that are provided?
Helping people get dressed, helping people do their shopping, accompanying people to medical appointments, helping them get in and out of the car. It's just a little bit of help that people might need to live independently, but they don't have a medical need.
Yeah, a lot of people want to stay in their home, but they would maybe be forced to go into nursing home or assisted living. Otherwise, I would think if home care wasn't available.
Exactly, and that's one of the huge benefits of the program is it's saving a lot of dollars because nursing homes are much more expensive.
What are some of the challenges for with home care for residents as well as for the industry itself?
There are a lot of challenges that we face in the industry, but a major one that we're facing right now is a shortage of workers, and that's resulting in people not getting the care they need. So it's an important issue that we're facing.
What kind of, do you call them caregivers or?
Yes,
yeah.
Caregivers.
So what would be the qualifications and what kinds of jobs do you have open?
The qualifications are everyone has to pass a background study and have training, a state standardized training that people go through. And then they also receive training in working with a specific client's needs because every client is different. So that's what we do. We administer the standardized training, and then we have our nurse visit to give more specific training to that person.
And there's lots of organizations that provide home care, or is it more limited?
There are many. I think there's somewhere around 600 home care agencies in Minnesota. So.
And I understand you've developed an app that can help caregivers. Why don't you tell us about this app? Why did you develop it, and what
Sure,
can it do?
yeah. Well, we developed an app, and it was first designed to just provide an easy way for our caregivers to submit their time and track their hours. Soon after developing it, we learned that we could also use it to meet state visit verification requirements. There's a new law that all agencies have to verify services are being administered, and
a lot of regulations, I would imagine, right?
Yes, a lot of regulations in the home care industry, and this app helps meet some of those regulations.
And then how does this specifically work?
Well, the worker uses their smartphone to clock in and clock out of the app. The app tracks the GPS location when they time in and when they time out. And then once during every 90-day period, the app will ask for a selfie with the caregiver and the client to verify services, if they've chosen that. The other option is to receive a telephone call to verify services.
You said that it started off one way and you've kind of expanded it. What do you think about it? How is it working?
It's working well, and right now we've actually launched a pilot where we're letting 25 other agencies test this app for free for a year, just because we want to get it working properly, because we see mandated visit verification in the future for Minnesota, possibly. And we want to be ready if that happens and have a product that's going to work and meet the needs of Minnesotans.
So if someone's interested in getting more information about Best Home Care, about also about a job perhaps, or caregivers looking for their loved ones for Best Home, where do they go? How do they go about doing that?
Sure. We have a website that's full of information for people to learn about the home care program and us. That's www.besthomecaremn, like Minnesota.com, or they can call our office, and our office number is 651-330-2550.
All right, we'll have that on the screen as well.
Sure,
then.
sure.
So, and then final comments about home care and what people should know about it.
If you think you may have a need, or your family member may have a need, don't wait. Call up an agency and find out, because help is there.
As we mentioned before we went on, I was saying how my mother-in-law has been really helped by having someone there. So that's been great for the family to know that there is someone there available to help her with all those needs and things. So
Yes, it's a great service.
It's been nice to meet you and glad to have you with us.
Thanks so much.
Thank you.